Hello, beauties, and welcome back to another Fabulous Confabulation with me, Jay Mills. Now today, I have the pleasure of speaking to two beauties who have a heart for dentistry. The first beauty is Dr. Miriam Furlong, who is the practice owner at Jackson Orthodontics. Dr. Furlong's orthodontic certificate is from Montefiore Medical Center in Bronx, New York. She received her DMD, Doctor of Dental Medicine, from Rutgers Dental School. She also volunteers her services to patients in need at no cost. I must add that Dr. Furlong received honors and awards including Top New Jersey Dentist / New Jersey Monthly Magazine, Top Dentist in Ocean County, and Jackson Alumni Hall of Fame 2012. The other beauty is Dr. Maureen Bennett, and she works with Dr. Furlong at Jackson Orthodontist. Dr. Bennett also received a DMD. She completed her orthodontist residency at Tufts University in Boston, Massachusetts. And prior to that, she graduated at the top of her class in Tufts Dental School with several prestigious awards. I would like to welcome Dr. Furlong and Dr. Bennett.
Thank you.
Thank you.
How are you guys?
Very good.
Excellent.
Can you just tell me, Dr. Furlong, what an orthodontist does and who they are?
Yes, so an orthodontist is a dental specialist, and we go to school for additional training, 2 to 3 years of additional training, specializing in the correction of oral and facial deformities and the alignment of the teeth and jaws. So when somebody would go to the orthodontist, for example, they would have their braces adjusted or perhaps Invisalign, things of that nature that involve correcting alignment of teeth and jaws.
Okay, so what's the difference between a dentist and then the orthodontist?
Okay, so a dentist is, they can perform general dentistry. They are taught to understand all aspects of dentistry, and typically when someone goes to the dentist, they'll go for their general overall oral health care.
Okay.
Kind of like you would go to your general physician or your doctor for your regular physicals and exams and general health care. And a dental specialist, for an orthodontist, that we specifically perform things related to that particular part of dentistry.
Okay.
Just like maybe a plastic surgeon or an OBGYN is a specialist in medicine.
Okay, so it's basically more specific.
Definitely. Correct.
Okay. So what are the steps to become an orthodontist?
Dr. Bennett, since you've been through it more recently.
So first you have to get your bachelor's degree, and that can be in a variety of different subjects.
Okay.
And you typically have to do certain specific prerequisite classes. Then you would apply to dental school. Then you would do 4 years of dental school. And then if you are going to be an orthodontist, you would go to 2 to 3 years of additional specialty training in orthodontics.
Okay.
So it's a long time.
That's a long process. So does one have to practice as a dentist first before applying to specialty programs such as orthodontist?
They do not, but some people do. So
Okay.
I did not practice as a dentist, Dr. Furlong. I don't know if you
Nope,
did.
I didn't. I went straight from dental school into my residency.
Okay.
Which is the same thing I did, but I had classmates who worked for a couple of years first and then decided to go back and become an orthodontist.
Okay. So it's basically an option.
Yes,
It is an
absolutely.
option.
All right. Dr. Bennett, what made you change careers as an RN, which is a registered nurse, to being an orthodontist?
Okay, so I decided to switch over to dentistry so that I could give people a nice smile and help them feel better about themselves, but not have to deal with some of the more difficult aspects of medicine, such as life and death.
Mm-hmm. Yeah, and I've been going to both of you for a while now, and I can say that I've had the best experience with both
great.
of you. I absolutely love coming here.
It goes both ways,
Yes.
Jamila. You've
Yes.
been a
Thank
pleasure,
you.
and we all love you here. So.
Thank
course.
you.
Because you call us beautiful.
Yeah.
So, Dr. Furlong, what gave you the desire to not only become an orthodontist, but to also have your own practice?
Probably, I had an experience when I was getting ready to complete my training, my orthodontic residency. And I had been speaking with an orthodontist, and I really felt like I had a job lined up, ready to go. I just assumed it was all going to work out. And at the last 6 months, he stopped answering my phone calls, and eventually he contacted me and said, "Oh, we're not looking anymore. We realize we're not ready to bring in another doctor." And that really set a light bulb on over my head that I didn't want to have to rely on anybody else. And I was then determined to figure it out, and that I was going to own my own business, because I didn't want that to happen to me again.
Right.
And I'm really glad it did happen to me, because when of course, you can, but I didn't just open up a business. It's very difficult. You should have experience, and you should learn, which I did. I worked for a few years, always with the intention of eventually opening my own practice. But it just, it was, everything that happens for a reason, I believe.
Right,
So
yeah.
that was a little kick in my butt to say,
Right.
You need to do this.
Yeah, and it was that experience that made you do this. And
Correct.
if it wasn't for that, maybe it would have took longer, or who knows?
Who knows? Exactly. So that gave me a lot of motivation.
Right. As a student, what was some challenges that, happened while you were becoming an orthodontist?
When I was taking one of the prerequisite classes in college, I had a professor tell me that women shouldn't be doctors, and gave me a very poor grade on my final exam that I don't think necessarily was justified, and then that gave me some extra motivation to retake that class, and I aced it, and I kind of put my nose to the grindstone, and it really made me want to do this even more. So I think that was an experience where I wasn't going to let someone else tell me what I could and could not do.
Right.
And so that gave me extra motivation to really go ahead and do it.
Wow, I can't even believe that someone would say something like that.
Yeah, people say crazy things.
Yes,
Yeah.
Especially as you get older, people, they'll very happy to tell you what they think you can and can't do, and you just can't listen to them.
You
Right.
pushed.
Yeah, exactly, exactly.
What do you enjoy more about being an orthodontist? And that goes for both of you. So, Dr. Furlong, you can answer first.
What do I enjoy the most about my career?
Yes.
Probably what Dr. Bennett was touching on, how the what we do is not life or death.
Mm-hmm.
It's, for the most part, elective, so people have a choice, and they will come to you because they choose to, not because they're in desperation, and so it's a more lighthearted type of a field of work, which some people might want to save lives. I think that's great.
Yeah.
But of course you can't always succeed, and I don't know if I'd be able to deal with the failures when you're trying to save somebody's life. So I think because it's happy in general, the patients are healthy, they are appreciative for the most part, and it makes a really big difference in somebody's self-esteem. It did for me when I was a kid, so I think that's really rewarding.
Right. So you're definitely helping in a way. You're not saving lives to the extreme, but you're definitely helping.
Yes, and I think it does improve I know it improves the quality of life for the majority of our patients, and it's a nice feeling.
Mm-hmm.
Yeah, and I'd say mine is very similar to the same. Yeah, I mean, the emotional difficulties when I was an RN was one of the things that was definitely hardest about it, and I give absolute credit to people who can, do those situations their whole life, and we need them in our world, but that I just emotionally wasn't one of them. Right. And I love the fact that today we took someone's braces off. They're so happy. They give you a hug. They're so excited to take pictures, and it's just a lot of fun. Mm-hmm. So we have a great time. I'm still waiting for mine.
I
know. You'll get your turn.
I know. Okay, so in your own words, be honest. What is the least thing that you don't really like about being an orthodontist?
Okay, the least. Well, it's never fun to have to reprimand somebody who isn't doing what they're supposed to do. So I think if every patient was cooperative and wonderful like you, then I would have no complaints. That is not necessarily the case. Beside that, being a business owner, there are separate pressures on it as me as a business owner. But all of them I would take in a heartbeat. The rewards are far greater than any of the negatives in being an orthodontist and owning an orthodontic practice.
Mm-hmm.
I feel I'm so lucky every day. I would never trade it.
I'd say the worst is when you disappoint someone.
Okay.
And maybe they thought they were getting their braces off a little sooner and you don't get it off in time, and sometimes they cry. And then you feel terrible, but, eventually their braces will come off when they do get a great result. And so, it all works out in the end. But
Right.
those days, you never want to disappoint someone.
Right.
So that's
This
tough.
is true.
Okay. What are some common procedures and what are some highly complex procedures? And would you consider my procedure complex?
That's what I was going to say.
Dr. Bennett.
Yes. So impacted teeth are some of the most complex procedures that we deal with, as you well
Mhm.
know. They're unpredictable on how long they're going to take, how many times they're going to need to be exposed by the oral surgeon. We have to deal with other practitioners in treating them. So that's definitely one of our most complex procedures.
Okay.
Yes, it is. Also, some kids, kids, not adults, but they have abnormal growth patterns.
Okay.
So at times we'll have somebody who our training, we're trained to understand growth and understand growth patterns. However, the human body, you can't always figure everything out, and you can't always predict everything. So sometimes we'll have that a situation where we have an unpredictable or an unpredicted change in somebody's growth pattern. We do have ways to deal with it,
Mm-hmm.
but again, it gets more complicated. But that's why we have the training that we have.
Okay.
Mhm.
So, can you just explain to them what's going on with my teeth, like the exposure?
Well, I'm going to sum it up as stubborn tooth syndrome. Well, I actually went into the OR, which was really cool. And I happen to know the oral surgeon professionally. We've worked together for years. So the tooth that we are bringing in was very high, and it was aimed over other teeth in front of it.
Mm-hmm.
So when we first got together, I said we should try to bring this tooth in. And several years later, the tooth has budged, but not budged a lot. So every time we would consult with the surgeon after maybe a year, and say, does this tooth have a good chance of coming in? And the surgeon, with all his training, said, yes, I think so. And therefore, we keep trying to bring it in. And this most recent surgery, no doubt that tooth is not stuck or in any way that makes it hopeless. Mm-hmm. So I am very hopeful that it's going to move.
Yes. Yes. I want to give some of the beauties some tips on like how to maintain good health in teeth. So I'm going to ask you some questions about how to maintain good health. So, Dr. Bennett, what are the best ways to practice good oral hygiene at home?
So the best ways are to brush your teeth twice a day, aiming for about 2 minutes each time, and then doing your best to floss once every day.
Once every day. Okay. Dr. Furlong, how often should a person get a dental checkup?
That is an excellent question. Typically, every 6 months is recommended. So I would say every 6 months. However, if you have a special situation, for example, some children have a hard time keeping their teeth clean, so they might have to go more frequently.
Okay.
I will never say that you should go less frequently, but everybody is different, and your general dentist, your primary dentist, would be the best one to say, you are prone to having XYZ PDQ, you need to come this often. Mm-hmm. But I would say 6 months is the general rule of thumb for checkups.
All right. How does a person know if they need to see an orthodontist?
So oftentimes we get referrals from the patient's general dentist, so whether that's their family dentist or a pediatric dentist, that they might have noticed something different or something unusual about their bite. Or sometimes patients come in to see us on their own. Maybe they feel like their teeth aren't coming together properly. Maybe they're noticing crooked or out of alignment teeth, and then we will evaluate them and give them a good plan as to how grown up they need to be when we get started, and how we should treat them.
What is the difference between Invisalign and then braces, traditional braces?
Invisalign is a brand name for a system that uses clear, removable plastic aligners.
Okay.
There are other brand names. However, just like Q-tips are the most well-known cotton swab, Invisalign is the most well-known system for clear aligners. They do the same thing, meaning they push the teeth where the teeth need to go in terms of traditional braces versus Invisalign. However, traditional braces are attached, they're bonded to the teeth, and Invisalign is, or something like that, clear aligners are removable. So pros and cons, there are pros and cons of both. One pro of something removable is that you can take it out of your mouth to clean your teeth and floss, and it's a little bit easier. A huge con, however, is that means that if a patient doesn't feel like wearing it, they're maybe forgetful or they just don't want to do because their teeth are sore and they leave it out, nothing happens. So it's definitely pros and cons, and it depends on the person. Everything, it's a very individual type of thing, but they both work really well, and we do them both here, lots of them.
Lots of both.
Yes.
And now, is it always an option, or is it sometimes you have to get like traditional braces?
Well, I will say almost always it can be done both ways. However, some cases are better suited for traditional braces, and perhaps some cases are also better suited for something removable and clear like Invisalign.
So, Dr. Bennett, what is a good guide in choosing a new dentist and orthodontist?
Well, some of the best ways that we have met we know a lot of providers in the area, so if a patient comes to us and they need a new dentist or say an oral surgeon in the area, we refer them to someone we know in our professional network that we've worked with and that we know will take good care of their patients.
Okay.
So that's kind of the best way for us, because we get referrals from those doctors who also know that we take good care of our patients. So we want to interact with providers like that.
Okay.
Yes, absolutely. It's recommendations. Word of mouth. Ask people that you trust who who do they like. That's how you get to know the good and the bad and the ugly.
Okay.
And you want to stay away from the bad and the ugly.
Right. All right. So on your free time, and Dr. Furlong, you can answer this first. What do you like to do, like when you're not working?
Well, what do I do and what I like to do might be different things.
No, you can say both.
I'm just kidding. Really spending time with family, being my own husband and children, also my parents and my husband's parents, and our friends. But I like to stay in shape, so I try to get to the gym as much as I can. I love to eat, so I love to go out to eat, try different food. I love to eat different ethnic foods, and that's pretty much what I would be doing if I wasn't here. I don't shop very much. Maybe I would like shopping more. I don't know. That's not my thing.
Yeah.
So probably eating, working out, and hanging out with family and friends.
Nice.
Yeah.
We're very similar in this situation. But I'm not working out as much as I'd like right now because I have a new baby at home.
Right.
So
Congratulations.
thank you so much. So I'm spending a lot of time at home with my husband and my daughter.
Okay.
Which I love. And I like to go out to eat. We like to try different things. I also like to cook and try different foods that way. And then we like to just spend a lot of time out. We go to different fairs or different activities in the community, and that type of stuff is stuff we enjoy doing.
Okay, so you guys both like to eat. So what are your favorite restaurants? You can answer.
Zena in Toms River is a sushi place that's fabulous.
Love
It's great. That's actually probably my favorite one in the area.
Really? Okay.
Yep.
That's on my bucket list. I gotta get there.
You gotta get there.
Yeah. So I like Eco and Brick. I like Kodo and Jack's. I mean, too many restaurants for me to name, but I will say I do tend to favor Asian, whether it's Indian food or Thai or Vietnamese.
Yeah.
But I really like everything because my mom is German and my dad is French, and I just like to eat.
Right. Who doesn't? So do you guys have any last advice for the beauties who are watching?
I would say don't give up. If there's something that you want to go for, you should do it, and people are going to try and tell you that you can't, but you can't listen to them.
Yes, and any negative experience, don't cry over spilled milk. Dust yourself off, and go get back up and do it even harder. That's what I would say.
Right. So thank you guys for taking the time out to talk with me. But before you guys go, I do have a little something for you guys.
Okay.
Adorable.
Oh my gosh, that is great.
Thank you so much. We will
You're
wear these
welcome.
proudly.
Yes, we will.
Aw.
Thank you
Yes,
so much.
they are women with beauty and brains, and so are you. So thank you for watching.
Thank you.
Bye.